Welcome to the deep dive. Today we're diving into a really widespread health issue. High blood pressure, hypertension.
Yeah, it's a big one. It
Mm.
affects so many people. And what's concerning is how it often just creeps up silently over years.
Right, no obvious signs. That quiet progression. That's why it's such a major health concern globally, isn't it?
Absolutely. Significant damage can happen before you even know something's wrong.
Okay, so our mission here in this deep dive is to pull out the most important, actionable, natural strategies you can actually use. Things to help lower blood pressure, boost overall health.
And we found some, fascinating stuff in our sources. Challenges some of the common thinking, actually.
Good. And it's worth saying we're mainly focusing on primary hypertension.
Right. That's over 95% of cases?
Exactly. Doctors often call it idiopathic.
Which basically means they haven't pinned down one single cause.
Yeah. And because of that, it sometimes sounds like there's no real solution.
But we're going to dig into why that might not be the whole picture.
Definitely. We'll mention secondary hypertension briefly. That's the kind of link to other things like, say, kidney disease.
Mm-hmm.
But for most of you dealing with high blood pressure, it's primary hypertension. So
Oh.
we'll focus on that and the natural approaches.
Sounds good.
Okay, let's unpack this then. Weight. Lots of people hear about the link between weight and blood pressure. Let's start there.
Yeah, it's been studied quite a bit. The Framingham studies, for instance, they showed a pretty clear trend.
Okay.
On average, a 10% increase in body weight was linked to about a 6.5 millimole Hg rise in blood pressure.
6.5 points for 10% weight gain.
Yeah, so the main takeaway is even a moderate weight increase can, nudge your blood pressure up significantly.
That might not sound huge on its own, but it adds up, right?
Definitely.
Like think about someone who's maybe 210 pounds, but their healthier weight might be closer to, say, 165.
Okay.
That's like a 45-pound difference, over 20% increase. That could mean their blood pressure is almost 20 points higher just from the extra weight.
That's a substantial impact, yeah. It really can be.
So weight matters.
It does.
Yeah.
And look, weight is definitely something you can change. Losing excess weight certainly helps lower blood pressure.
But, I sense a but.
Well, yes.
Mm.
Our sources point to something often deeper, an underlying issue that frequently drives both the weight gain and independently pushes up blood pressure.
And that is?
Insulin resistance. It's not always the main driver for absolutely everyone, but the evidence strongly suggests it's a massive player for many people today.
Okay, now this sounds really interesting. Our sources are calling insulin resistance the most significant underlying cause.
That's what the research we looked at indicates, yes. For hypertension today.
Right. So for anyone listening who isn't quite sure what that means, can you break down insulin resistance? Why is it so crucial?
Sure. Basically, insulin resistance kicks off this vicious cycle in the body.
Okay.
You eat a lot of refined carbs, sugars.
Mm.
Your pancreas pumps out more insulin to handle it.
Makes sense?
But over time, your body's cells, they start becoming less responsive. They don't hear the insulin signal as well.
Okay.
And that leads to feeling hungrier, storing more fat, and finding it harder to actually burn the fat you have for energy.
So more sugar, more insulin, but the body kind of tunes it out. That explains the weight gain link. How does it hit blood pressure, though?
Right, this is fascinating. Insulin resistance also stimulates the sympathetic nervous system.
Your fight or flight system.
Exactly. The body's automatic rev-up system. When that gets activated, blood pressure goes up.
Why?
Well, think of it like your body's trying to get more oxygen to your muscles, almost prepping for action.
Huh. So it's like being constantly subtly stressed.
Pretty much. It's a similar mechanism to what happens when we're under a lot of acute stress.
Mm.
Your blood pressure naturally rises then, too.
Wow. So that wired, stressed feeling could literally be raising blood pressure via insulin resistance.
That's part of it. And there's more. High insulin levels also contribute to hardening of the arteries.
Making them less flexible.
Precisely. Less flexible means more resistance, higher pressure. It's like a multi-pronged attack on your cardiovascular system.
And our source mentioned something important.
Mhm.
You don't have to be really overweight for this to be happening, right?
And that's a key point, correct. It's
Yeah.
definitely more common if you carry extra weight, especially around the middle.
Abdominal fat.
Yeah, abdominal fat. But even people who look lean can develop insulin resistance. Diet and lifestyle play huge roles regardless of overall weight.
So how would someone know? How can you figure out if insulin resistance might be affecting you?
Well, the most direct way is blood tests. You can get your fasting insulin checked, and maybe after a meal too.
Okay.
And doctors can calculate something called the HOMA index. It's a score based on insulin and glucose levels that assesses resistance.
Right. Any clues you might notice yourself?
Yeah, more practically, if you have significant fat accumulation around your abdomen and you find it really stubborn, difficult to lose, that can be a strong indicator.
Okay, good to know. So if someone suspects this is going on, what's the fix? What can they do?
The really good news here is that it's very modifiable. Lifestyle changes make a huge difference.
Like what?
The key strategies our sources highlight are, number one, intermittent fasting, and number two, adopting a low glycemic index diet.
Okay, explain those a bit.
So basically, eating foods that don't cause sharp, rapid spikes in your blood sugar. Less sugar spike means less need for massive insulin production. Intermittent fasting gives your body breaks from constantly processing food and producing insulin.
Right, lets the system reset a bit. Makes sense. Okay, let's shift gears. Salt.
Hmm.
We hear about salt and blood pressure constantly.
We do.
Our source seemed to suggest it's, well, more nuanced than just cut out all salt.
Yes, exactly.
Mm.
For years, the advice was simple: cut back on sodium. And look, for some people, excessive sodium is a problem.
That's right.
But the source really emphasizes the importance of the balance of minerals, particularly the balance between sodium and potassium.
Ah, so it's about the ratio, not just ditching one?
Precisely. It seems potassium deficiency is actually a frequent contributor to hypertension, especially if you're also getting a lot of sodium from, processed foods and less healthy sources.
How deficient are we talking?
Well, get this. Our Paleolithic ancestors, they likely consumed 5 to 6 times more potassium than the average person does today.
5 to 6 times. Wow, that is a massive difference. What's the recommendation now?
The current recommended daily intake is around 4,700 milligrams. That's almost 5 grams a day.
And does getting enough potassium actually help?
Studies show it does. Adequate potassium helps reduce blood pressure, and it's linked to a lower risk of heart attacks and strokes, too. It actively helps balance out sodium.
Compelling.
Yeah.
So how do we boost our potassium? Is it just popping
The
supplements?
source specifically flags whole foods as the best route. Think green leafy vegetables.
Spinach, kale.
Exactly. And nuts, too. They suggest supplementation alone might not give you the same full benefit as getting it from food.
Okay, load up on greens and nuts. Got it. Now, vitamin D. That feels less obvious in the blood pressure discussion.
It might seem that way, but it's actually fascinating. Vitamin D isn't just a vitamin. It functions much more like a hormone.
A hormone. How so?
It influences tons of systems. Bone health, obviously, the immune system, and yes, the cardiovascular system.
Okay. How does it affect blood pressure directly?
Well, your arteries actually have receptors for vitamin D.
Really? Inside the artery?
Uh-huh. And studies show vitamin D plays a central role in regulating the muscle tone within those arteries, keeping them appropriately relaxed or constricted.
So if you're low on D,
Well, deficiency is linked to a higher risk of hypertension, but also atherosclerosis, that hardening of the arteries and heart attacks. So yeah, low vitamin D is definitely not just about your bones.
not at all. And the source mentioned it works similarly to some medications.
Yeah, this is really interesting. Vitamin D actually lowers blood pressure through a mechanism that involves the renin-angiotensin-aldosterone system.
That's a key system for blood pressure regulation, right?
It is. And some common blood pressure meds target that same system. So vitamin D seems to interact with it naturally.
That's a powerful connection.
Right.
Is deficiency common?
Sadly, yes, very common. Modern lifestyles, less sun exposure, dietary factors, lots of people are deficient.
So maybe getting some safe sun, checking levels with a doctor, considering diet or supplements might be important steps.
Could be very important, yes. Okay, moving on. Magnesium, another mineral. We often hear about it for relaxation, right?
Yeah, good for nerves, muscles, sleep sometimes.
Absolutely. Benefits for testosterone, digestion, muscles too.
Yeah,
And when we talk blood pressure, its main role is relaxing smooth muscle.
including the muscles and artery walls.
Exactly. The muscles that control the tone, the tightness of our arteries.
So low magnesium means tighter arteries, higher pressure.
That's the idea. If you're not getting enough magnesium, or maybe if chronic stress is depleting your levels, that can lead to increased tension in those arterial muscles and consequently hypertension.
Makes sense. Stress really does feel like it tightens everything up. Okay, now, calcium. We think bones, but you mentioned K2 earlier. This sounds like a balancing act.
It really is. Calcium is vital, no question. It's needed for muscle contraction, including in blood vessels.
But,
But too much calcium floating around or calcium going to the wrong places can contribute to arterial hardening, plaque formation.
okay, so it needs directing. And that's vitamin K2's job, like a traffic cop for calcium.
That's a great analogy. Exactly. Vitamin K2 is crucial for telling calcium where to go into your bones and teeth.
And not into your arteries.
Right. Keep it out of the soft tissues like arteries.
Mm.
This helps prevent that arterial hardening, which especially affects the diastolic pressure, the lower number.
Keeping arteries flexible, super important.
Absolutely. And the source did note it can be kind of tricky to get enough K2 just from diet for some people.
So supplementation might be something to discuss with the doctor.
It could be worth exploring, yes.
Interesting. Okay, the source also briefly mentioned cholesterol drugs, statins, and their potential impact on some of these nutrients.
Yes, just something to be aware of. Statins are obviously very helpful for many people,
Huh.
but they can potentially lower your body's levels of vitamin D, vitamin K, CoQ10, and omega-3 fatty acids.
And all of those are important for heart health, right?
They are. All play roles in cardiovascular health that we've touched on or are generally known.
So if you're taking a statin, maybe have a chat with your doctor about whether you need to consciously boost your intake of these other things.
Seems like a prudent conversation to have, yes. Making sure all your bases are covered.
Good point. Now, besides these specific nutrients, the source also flags those other lifestyle things.
Right, the ones we often hear about. High alcohol consumption,
Sedentary lifestyle.
high stress levels, smoking.
Yeah. And these are framed as modifiable habits, things you can change.
Absolutely. Things like heavy drinking, for instance, can directly raise blood pressure and damage the heart muscle over time. Being sedentary affects insulin sensitivity and weight, stress.
Well, we talked about the sympathetic nervous system.
Yeah. So addressing these is also a key part of the puzzle.
A crucial part of any holistic approach, definitely.
Okay.
Yeah.
Wow, we've covered a lot of ground here. Let's try and pull it together for everyone listening. What are the main, actionable steps you can take away from this?
Okay, the core strategies seem to boil down to this. First, tackle potential insulin resistance. That means looking at a low glycemic diet, maybe intermittent fasting.
Right. Reduce the sugar spikes.
Second, if you're carrying excess weight, work on losing it. We saw how much impact that can have.
Uh-huh.
Third, boost your intake of those key minerals and vitamins, potassium, magnesium, vitamin D, and vitamin K2. Focus on food sources first.
Greens, nuts, maybe some sun.
Exactly.
Mm.
And finally, actively manage those other lifestyle factors. Get moving, find healthy ways to handle stress, watch the alcohol, don't smoke. It really sounds like these natural changes, taken together, could make a pretty significant difference.
The potential is definitely there. The source even mentions studies showing magnesium and potassium supplementation alone can sometimes be nearly as effective as certain blood pressure meds.
Really?
Yeah. So when you combine addressing weight, fixing insulin resistance, and sorting out these vitamin and mineral levels, the overall effect to be quite substantial.
So for you listening, the takeaway is you have some real concrete actions you can start thinking about today. Things to naturally support healthier blood pressure.
Absolutely. Even starting small, like gradually shifting your diet towards lower glycemic foods or exploring if intermittent fasting fits your life. Those are great first steps.
This whole deep dive, it really underscores how interconnected everything in the body is, doesn't it?
It truly does.
How these seemingly small tweaks in nutrition, in lifestyle, can have such a profound impact on something major like hypertension. It really makes you think about how complex and responsive our bodies are. It maybe invites a bit more curiosity about how we can best support our own health.
Well said. A lot to think about there.
Thanks for diving deep with us today.